All right, Dr. Nguyen here. I want to talk to you about how I personally do my figure eight extractions, okay? So here, I apologize for the quality of this bite wing. There was a better one that actually showed the bone levels of the maxilla, but I accidentally uploaded this one, so we're going to have to run with this one, okay? Here, I see the patient has been in pain for a number of months and finally makes his way in. We have a very large mesial decay, taking up about 1/3 to 1/2 of the internal tooth structure. And then we have a hyper-erupted number 3 that poses an issue for us because it's wedging in tooth number 4. Now, could this tooth have been saved? Technically, yes. But I discussed the risk, benefits, and alternatives. Patient elects for extraction, no bone graft. Okay? So we move forward. Here, the PA is about to come up. There's a couple of issues that I see as well. I see a mesial curvature of tooth number 4, which warrants concern. And I also see an active infection happening at the apex. And then again, you can see the mesial decay there. Okay. So first things first, let's get them numb. I like to numb up the posterior and the tooth posterior and anterior to the tooth being extracted as well. And then I first do a slot prep on the distal aspect of the tooth to help circumvent around the issue of the tooth being wedged in. I do not recommend this for anyone who is concerned about fracturing the tooth structure, the coronal tooth structure. And don't get me wrong, I'm very concerned about that as well. But if you do not feel comfortable being able to retrieve a fractured retained root, I wouldn't recommend this way of doing it. But this is the way I felt comfortable approaching this tooth, so I went ahead and did that. So here I'm elevating off the mesial, and then I start elevating off the distal, and I see some movement on 3, and I do not like that whatsoever, so I mostly elevate off the mesial. Now my rule of elevating is keep elevating, and then when you think you're done elevating, elevate some more. There is a time and place for forceps, and I respect the tool, but I don't like them as much overall because they fracture teeth all the time if you're not careful. So here I'm elevating to the point where I see good movement, but I know that mesial curvature is hanging up the tooth. So I continue to elevate and hold it there for quite a little while. And then I actually know I'm compressing enough bone and getting enough movement to where I can place some forceps on. Okay, so here I want to talk about doing the figure 8 motion too. And the arrows are going to come up to show you which direction I'm thinking. Long story short, I'm thinking line angle to line angle to line angle to line angle. So here we have the mesial buccal. I want you to, well, personally, I hold the forceps with a firm grip, but I do not white knuckle the forceps because as you can tell, the tooth structure is very, very weak at this point. So I do not want to hold on to these forceps very firmly. Okay? I'm definitely not white knuckling it right now. So we're moving from line angle to line angle to line angle, all the while feeling the bony expansion with my left hand. Okay? We're doing distal buccal here, back to mesial lingual, and then moving in that figure 8 motion, and then tooth is out. Okay, now we can see the curvature of the root, and we can see the granulation tissue right there at the end. Okay? We're going to take a look at this again. I'm doing line angle to line angle to line angle. Mesial buccal with a firm grip but not white knuckling it, and feeling the bony expansion here. And then from there, deliberate movement to the distal buccal and holding it there for a while as it's compressing the bone down, moving it to in a diagonal line to the lingual areas, and then to a diagonal of the mesial buccal. And soon enough, the bone is being compressed enough to where we can remove the tooth entirely. Okay, so that's how I do my technique. Whatever works for you, I recommend you continue doing whatever works for you. I hope that's been informative. I actually showed the patient this video, and he really did enjoy watching it from my angle. So there's patient consent, and then we had the patient sign a consent form as well, okay, like always. So thank you so much for watching, and I appreciate the support, and take care.